Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today we're going to discuss a very important cause for the chronic vision loss, which basically comprises of the macular degeneration. Now, we have studied the other causes for the chronic vision loss in a person, which basically ranges from the cataract formation in eye. It can be unilateral or bilateral vision loss due to the cataract formation. Then we studied glaucoma, which is another cause for the chronic vision loss in a person. And on the other hand, we have the macular degeneration. So all of these causes that we have studied, they have these different bases for their formation, ranging from trauma, infections, inflammations, and one of the basic cause for this vision loss is age-related. So another significant reason for the chronic vision loss, which is again age-related, can be the macular degeneration, which we're going to study in this lecture. So over here, we're just going to focus, first of all, in the very first section, we're going to focus on the definition of macular changes that occur according to the age of a person, and what are these particular changes that are happening. It can be the atrophic kind of the macular degeneration, which is basically known as the dry kind, and then on the other hand we have the wet macular degeneration, which is basically of an exudative form. So these are some of the changes that are taking place. These are the age-related macular degenerative changes that are happening to the person, and they're again basically resulting in the vision loss of the person. So the types we're going to discuss, as we've already gone through the wet form and the dry form of the macular degenerative changes, and then we have the pathophysiological basis for the macular changes, which is happening to the person as well. So we're going to study what are the changes that are happening at the macula. A macula is basically a spot behind the eye. Obviously, it is located on the retinal structures, and it is important for the central vision. It is responsible for the central vision of the person. So any changes that are occurring at the macular level in the center of the eye, it can result in the macular degenerative changes. So this is the first section that it is comprising of, and then we're going to move on to the second section, in which we're going to study the macular degenerative management. So you have a patient of macular degeneration at your hand. How are you going to manage this case is again very important and significant. We have these different investigations that are being carried out. Say for example, the Amsler grid charting, that is basically just charting the fact that what is the type of the vision loss, what are the defects in the vision field that can be calculated in this particular patient of macular degeneration. Referral forms are specially designed for this macular degenerative patients, and we'll be going through these referral forms just to give you an overview regarding these patients, how they can basically be referred to the specialist, because you as a clinical physician should know how to diagnose a case of macular degeneration, further refer him or her to an ophthalmologist for further reviews and managements. The treatments would be discussed very briefly in this section as well. We'll be discussing the modern techniques that are being used these days, and then we'll be discussing all of them over here in this very second section. Third section, we'll be focusing on the prevention of the macular degeneration. So again, it's very important. The primary preventive measures are again calculated along with the secondary measures, and then we're going to focus on the systemic changes. So there are a lot of systemic illnesses that can contribute towards these macular degenerative changes. We'll be discussing them as well over here. And then the lifestyle modifications, which can be helpful for the prevention of the macular degeneration in a person. And then finally, the future trends. A lot of research work is being carried out on this phenomena of macular degeneration, and we'll be discussing that very comprehensively over here in this last and third section. So I hope you want to learn more about this macular degeneration. So do watch the other sections to this lecture as well.